That means you're going to ask them to go through the movements. Okay? So, active, where's the active, right? It says flexion extension. Okay, so you're going to have to ask them to go into flexion and then go into extension. So raise your leg up. That's flexion. Okay? Then you ask them to go into extension, drop your leg back down. That's extension. Okay? Then you're going to ask them internal, external rotation. Okay? You can do it this way. You can ask them, turn your toe in that way. Okay? Internally rotate your hip, turn it out. Externally rotate your hip. Okay? Or you can do it this way. Okay? Turn your foot this way. Turn. Okay? That's internally rotating her hip. Go the other way. That's externally rotating her hip. Okay? And then you want to do abduction and adduction. Abduction is her feet separate like this. So push, bring your leg out, bring your leg back in. That's adduction. Okay? Transverse adduction. Okay? Bring your knee over here. Okay? Bring your knee outward. Outward this way. Good. That's transverse abduction. Abduction. Okay? So that's active. Passive is you or me. I'm going to do the movement. If I go to hip flexion, hip extension, okay? Internal rotation, external rotation, all right? Hip abduction, hip adduction, okay? Transverse adduction, transverse abduction, okay? That's passive. Now, resistive is she's going to do the motion, you're going to add a little resistance. Okay? So raise your legs up. Up, 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 up. Okay? Push it down. Okay, what movements did I just do?
Flexion extension.
Flexion extension. Push your leg out. Out, 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 out. Pull it in. What movements?
Abduction,
Abduction, adduction.
Yeah.
Okay? Bring your leg outward. Push. Not like this. Push. Okay, what movement is that?
Internal, external.
Internal rotation.
External.
Push it out. External rotation. Okay, bring your knee across over here. Okay, what movement is this?
Transverse.
Transverse adduction. Adduction. Okay, push your leg out. Transverse abduction. Okay, so now we just did this whole thing. Okay, easy, huh? Stop. Okay? Right? Go ahead, get off. All right, take a seat. Okay, now you're going to do the manual muscle test. Okay? So for flexion, okay, A. Say all you got to do, so you're going to check the I'm going to check the quadriceps, the rectus femoris, all right, and the iliopsoas. So you put your knee, hand on the knee, and I say raise up. Raise your knee. Push, 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 push. Okay? And for extension, you ask her to push down. Push down, push, 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 push. For extension, you're just going to repeat hamstrings, biceps, and more gluteus maximus. Okay? Adductors. Okay? You're going to check for the pectineus, adductor magnus, gracilis, actor, brevis, and longus.
What?
Okay? So you ask her to put your hands on the inside of her knee and tell her to put your knees together. Push, push, push. Okay? And then for adductors, you're going to be checking for the gluteus medius, tensor fasciolata, and the gluteus minimus. And so you put it on the outside of the knee, push out. Push, 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 push. Okay? And then you do internal rotators. Okay? Checking the pectineus, adductor magnus, gracilis, brevis, longus. Okay? So internal rotation, her feet have to go outward. So push, push, outward. Get over. Yeah. Push, 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 push. Good. Internal rotation is opposite. Pull in. All right, and then you type the gluteus medius, luminous, fascia, and sartorius. Okay, so now we just did all those.
So you just have to say it while you're doing it? Okay.
Right, the hardest part is learning how to
The
say
words.
words. Okay, the other stuff is easy.
Hey, should we pronounce them right?
Yeah, it's got to be like
What are the one you just said? I'm just like, what are the dogs?
sartorius.
No, the long one you said.
That's a question.
That's a fascia. You say that when you order a freaking coffee.
Latte.
What? Where did you get coffee?
Huh? American macchiato.
No,
Same thing.
I get
You're just learning new words. Okay?
Okay.
You just can't bitch and complain about how hard they are. You got to learn it. Right?
Oh, it's okay.
So Gillett's test. Gillett's test is, you look, turn your cameras this way, okay? You're going to be facing the person's back and you're going to palpate the iliac crest and find this portion right here where there are little dimples. It's usually where the dimples in the cheeks are. Okay, not these dimples. Okay, the ones up here in the sacrum. All right? So turn around. Okay? And so you look, you find her iliac crest. All right? Follow it downward until you hit the sacrum. All right? And when you feel those two big bumps in the back, you put your fingers right below those two big bumps. Okay? And that's your palpation mark. Okay? And then that's all you got to do, really. There's more to the test, but I just want you to know. And then it just checks iliac, sacroiliac joint dysfunction. Okay? Restricted side moves very little. Unilateral stance is pain. Okay, so if you have her stand on one side. Okay? On your back. SI compression test. All right? What you're going to do is you're going to press down on her ASIS. Okay? So this is what it's going to look like. Right here, okay, you're going to be pushing down on these two bones. Okay? So you push down on these two bones, right? When you push down on these two bones, it's going to push, it's going to compress the the SI joints. All right? It's going to hurt that first. Okay? And then to confirm it's the SI joint, you ask her to lay on her side. Okay? All right, and then you push down on this bone right here, okay? So when you push down on the bone, it opens up the SI joint. Push down, opens this side up. Okay? So this is the distraction test. The other one's the compression test. All right? And then the Thomas test is, usually you have the person hanging off the table. Her butt's right here, right? Her legs are kind of hanging off. Then you ask her to bring her knees to her chest, all right? Bring your knees to her chest. All right? And then you look to see what her legs do on the opposite side. All right? Go ahead and relax. Okay, you see how her legs are like, her hips bent right here? Okay, that means she's has tight hip flexors. All right, because if I press down here, okay, you can see it goes, ow, because it's stretching it. Okay? And then, by having her legs straight, it means her quadriceps are tight. All right, they're not relaxed. If they were relaxed, they'd be like this. Or they'd be like this and bent, hanging off the table, bent down. Okay? Since they're almost straight, it means they're tight. So, she could use a little stretching. Right here, okay? With her hip flexors and her quadriceps, okay? All right? To recheck it, again, you're going to put her in a figure 4. Okay, and you see how her knees are up. Okay, the hip flexors are a little loose, so it'll flatten out even more. Okay, so she can feel it like this. You can feel the tightness right here. Trendelenburg, all you have to do is, if they complaining of pain along this side, you ask them to stand on that one leg, and if they have weakness in their gluteus medius, they won't be able to stand. You have to ask them to stand on one side. Okay. Or if you just watch them walk, they'll kind of like, because they can't. They have a weak side right here. All right? And then the hip scoring test is like a grind test in the shoulder. Just bring the leg up like this, and you kind of just circle around. And you're trying to feel with your hands, right, how her hip is moving around in her hip joint. Okay? And then the myotones. You check. Hip flexion and extension. So you ask her to sit on the edge of the table. Okay. Okay, so you're going to recheck hip flexion and extension. Okay, so ask her to bring her knees up. Just hold it. Okay, L2, L3. Push down. L4, L5. Right, straight leg raise. Checks the sciatic nerve, irritation, tight hamstrings. Ask her to straighten her leg out. That's a straight leg raise. Okay. Slump test. To verify if this is correct, all right, you do the slump test. You ask her to raise her leg up like this, okay, and then bring her chin to her chest. Okay, and the intensity of the nerve pain will increase by her going like this, because now this whole neural system is stretched out even more. Okay, so the intensity of discomfort goes up. All right, and that's it. All right, so